Hi guys, I'll present a quite short video about acute bronchitis. So what are the objectives of this video? Describes the presentation of a patient with pathology like acute bronchitis, explain how to distinguish acute bronchitis from pneumonia, very important, and management and treatment options for acute bronchitis, and summarize the importance of the interprofessional team in caring for and counseling patients with acute bronchitis. Acute bronchitis, as you know, is an inflammation of the large airways of the lung. About 5% of adults have an episode of acute bronchitis each year. 5% of adults. An estimated 90% of them or of this seek medical advice. Top 10 most common illness among outpatient in US. Etiology of acute bronchitis is caused by infection of the large airway, commonly due to viruses, not bacteria. So it is usually self-limiting. 95% is secondary to viruses, and only 5% could be caused by allergens, irritants, or bacteria. And irritants at the same time could be smoke inhalation or polluted air inhalation or dust. As a pathophysiology, you have to know that inflammation of the bronchial wall lead to mucosal thickening, epithelial cell desquamation, and denudation of the basement membrane. Acute bronchitis is commonly seen during the flu season, which is common during autumn and winter. It can follow any upper respiratory infection, especially viral. And the common pathogens are respiratory syncytial virus, influenza virus type A and type B, parainfluenza, and rhinoviruses. Factors like a history of smoking, living in a polluted place, crowding, and a history of asthma are all risk factors for acute bronchitis. It can also be triggered in particular by allergens, by pollens, perfumes, or vapors. When the infection is not virus but bacteria, and it is isolated, can be those which are responsible for community-acquired pneumonia like Streptococcus pneumonia or Staphylococcus aureus. How do you recognize patient with acute bronchitis? It's coming with productive cough, malaise, difficulty breathing, and wheezing. And usually cough is a predominant complaint, and the sputum is clear or yellowish. Sometimes could be purulent. Purulent sputum does not correlate with bacterial infection or antibiotic use, or the different stages or episodes of antibiotics takes. Cough after acute bronchitis typically persists for 10-20 days, but occasionally even for 1 month or more. So after you resolve acute bronchitis, cough may persist. The median duration of the cough of acute bronchitis is 18 days. Paroxysm of cough accompanied by inspiratory whoop or post-tussive emesis should raise concerns for pertussis. A prodrome of upper respiratory infection symptoms like runny nose, sore throat, fever, and malaise are common. And a low-grade fever may be present as well. In times that high-grade fever in the setting of acute bronchitis are unusual, and further diagnostic workup is required to make differential diagnosis, for example, with pneumonia. Evaluation of a patient is so clinically based on history, past medical history, lung exam, and other physical findings. Oxygen saturation or SpO2 plays an important role to judge the severity of the disease. Also pulse rate, if a patient have tachycardia or increased respiratory rate. Chest X-ray, very important to know that it is not essential, but may demonstrate increased interstitial markings consistent with thickening of bronchial wall. A chest X-ray differentiates pneumonia from acute bronchitis when infiltrates are seen at different levels, like it is lobar or any type of pneumonia. ACCP, or American College of Chest Physicians, recommend obtaining chest X-ray only when heart rate more than 100 or tachycardia, respiratory rate more than 24, oral body temperature more than 38, egophony and fremitus. A complete blood count may be ordered as a workup for fever, and white blood count might be mildly elevated in some cases of acute bronchitis. What is the treatment and management of acute bronchitis? It's usually self-limiting, and treatment is typically symptomatic and supportive therapy. For cough relief, we can give a hot tea, honey, ginger, throat lozenges, and antitussive agents like dextromethorphan and codeine. And also beta agonists are routinely used in acute bronchitis patients with wheezing, so it relieves bronchoconstriction and bronchospasm. Analgesics and antipyretics agents to treat malaise, myalgia, and fever. And prednisone or other steroid drugs can be given to help with inflammation as well. ACPP, or American College of Chest Physician guidelines recommend against antibiotic use in simple acute bronchitis in otherwise healthy adult and of viral origin. Antimicrobial therapy recommended in influenza infection, for example, with oseltamivir and zanamivir. Macrolides, which is the treatment of choice for Bordetella pertussis, along with 5 days of isolation. And procalcitonin might be useful in deciding on antibiotic use, which is indication for bacterial infection and sepsis. Lifestyle modification like smoking cessation and the avoidance of allergens and pollutants are important part of lifestyle. And flu vaccine and pneumonia vaccine in adults, and especially in older patients more than 65 years old, which is admitted and recommended. You have to make differential diagnosis of acute bronchitis to asthma, misdiagnosed as acute bronchitis in 1/3 of patients who present with acute cough. Also acute or chronic sinusitis, bronchiolitis, chronic obstructive pulmonary disease, gastroesophageal reflux disease, viral pharyngitis, heart failure, pulmonary embolism. Sometimes secondary pneumonia can develop, and usually indicated by worsening symptoms like productive cough and fever. If you see patient with productive cough and fever, in such case you have to indicate chest X-ray to detect some opacities or infiltrations and make diagnosis of pneumonia. Sometimes aggressive coughing can lead to spontaneous pneumothorax and spontaneous pneumomediastinum, but this cough should be very aggressive to produce such complications, and hence acute worsening of symptoms, and of course required chest X-ray, which initially we told that is not so reliable for acute bronchitis and will not show for us anything special like opacities in pneumonia. That's all. Have a great time, guys.